Thank you very much, Walter. I just will say that many of you have heard that Ovarian Cancer Canada was successful in getting the $10 million investment in ovarian cancer research, first time ever for the federal government. This talk's not about that, but do stay tuned. Because it's an election year, the money will probably flow in 2020. So if you don't hear it's out there and you're looking for grants, we're not sitting on it. We haven't got it yet, but it will be coming. So I'm excited to have the opportunity to talk about the Every Woman study. I am co-presenting with Dr. Oza, who's in a cab on his way here from the airport, but we'll forge ahead. The disclosures. Dr. Rose's disclosures, learning objectives, and then we did bring copies of the study. They're outside. Please take them home so that I don't have to carry them back. But it is quite a little impressive document. We're very proud of it. So the World Ovarian Cancer Coalition was established in 2016 by a group of international patient advocacy leaders. We built on the resounding success of the World Ovarian Cancer Day, the annual awareness day, May 8th, that's launched in 2013. Today, the coalition works with 135 patient advocacy organizations from 37 countries around the world. Since 2013, the World Ovarian Cancer Day campaign has reached well over 1 million participants from 50 countries, and it's been active in more than 45 languages. The coalition quickly realized the urgent need to address the global evidence gap related to the experience of women living with ovarian cancer. We believe that the evidence that we have got can serve to work towards the best possible chance of survival and best quality of life possible wherever a woman may live. Working with our 135 partner organizations from around the world to execute this study, we've gained much insight into the global disparities facing women living with ovarian cancer. The study also highlights the tremendous hurdles that unite all of us who are concerned about tackling this disease. So just looking at incidence, ovarian cancer is the 7th most common cancer and the 8th most common cause of cancer death in women around the world. Each year, 240,000 women are diagnosed with ovarian cancer globally, a figure that's set to increase by over 50% by 2035 to 371,000, according to the Global Can study. Expanding populations and increase of life expectancy are driving that projection, and that adds to the urgency to address poor survival rates globally. In addition to where women live, because of population sizes, it means about 55% of women with ovarian cancer are living in less developed parts of the world. Other risk factors include age and, of course, family history. Fewer than half of women diagnosed with ovarian cancer currently survive 5 years. And each year we lose 152 women to this devastating disease around the world. To put it another way, that's 416 women every day from ovarian cancer. Again, a figure that will rise substantially by 2035. These are not just statistics. These are someone's mother, someone's wife, partner, sister, daughter, friend, and colleague. We can, we must, and we will do better than this. So about the study, the Every Woman study is the largest, most comprehensive study of its kind in ovarian cancer. The expert advisory panel was chaired by Professor Nirja Bhatla, who's chair of the FIGO Committee for Gynecologic Oncology in India, and Anwen Jones, who's vice chair of the World Ovarian Cancer Coalition and the chief executive of Target Ovarian Cancer UK. In total, 1,530 women from 44 countries took part in our online survey, which was available in 15 languages. With a 5-year prevalence of 600,000, this gives about a 95% confidence level with a margin error at plus or minus 2.5%. During the course of the study, we also consulted or interviewed 37 clinicians from 15 countries. And as part of the Every Woman study, we produced the World Ovarian Cancer Atlas, drawing together all of the available data on ovarian cancer into one place. All of the full reports are available on the World Ovarian Cancer Coalition website. So this diagram shows the countries that are presented in the women's survey. The larger the text for the country, the higher number of responses. And for those countries that had more than 100 responses, we were able to identify some statistically significant variations from the average for all the responses. It's truly a global challenge that requires a global solution. Just a quick overview of the study, the component parts. The member survey was 37 organizations in 19 countries. We identified priorities amongst the patient and clinical groups. The atlas was a literature review based on global incidence, mortality, and survival, and it's an ongoing piece of work that we will update as stats change. We did qualitative interviews with women in hard-to-reach areas or where the coalition did not have a presence. And we interviewed clinicians in 10 different countries. So the survey was over 1,500 women in 44 countries with 5-year prevalence of 600,000. This gives a 95% confidence level, as I mentioned. And here's my co-presenter. There were 6 countries with over 100
great to be
entries.
late, huh?
Japan had the highest at 250, followed by the USA at 248. Australia, Canada, Germany, and the UK also achieved well over 100 each. This meant that we were able to highlight statistically significant variations. We spoke with 37 clinicians in 15 countries. So as I said, all of those findings are available on our website. So looking at the women in the study, it was a younger profile of women than we would have expected to see, but we believe that was mediated to some extent by the fact that this was an online survey promoted by member organizations to women that they reach via email and social media. Women were eligible to join in the study if they had been diagnosed since January 2013, and the reason was we wanted as up-to-date a picture as possible, not because we didn't value the experience of long-term survivors. Serous ovarian cancer accounted for 1/3 of the diagnoses in all countries, then endometrioid and clear cell were next, with an average of 10% each, although this was higher, 22% in Japan. Women in Japan more commonly experienced serous, endometrioid, and clear cell cancers on average a decade earlier than in the US and Canada. 12.5% of the women did not know what kind of cancer they had, and in Hungary that figure was higher at 29%. Germany had the lowest number at 2%. The advisory panel felt on the whole that the profile of women respondents was younger, healthier, and wealthier than we would have imagined. And so the caveat to the results that we'll present today is that what you see is probably the best possible case, especially when you consider the next slide. Thank you.
So thank you, and I'm sorry I'm a little bit late. So this was a sort of important study, and as Elisabeth has said, the study sort of really looked in terms of what is happening in terms of ovarian cancer, and I think she's already presented some of the context. And some of the context that we often forget, knowing that we sort of really have very good management systems in terms of ovarian cancer, is to really step back a little bit and ask the question in terms of how we're actually doing. And I think that there's still some startling statistics that actually are a bit of a wake-up call for us all, even in Canada, as well as other countries like Australia, US, as well as around the world. And I think some of these startling sort of statistics are like the ones that are sort of stated on this slide, that there is still a high proportion of women who actually don't get to specialist care and die very early in terms of their diagnosis of ovarian cancer. And a fully quarter of women with advanced ovarian cancer still die within the first 90 days. And that sort of reflects the scale of the problem. And I think that was why it was sort of really important to sort of ask the question in terms of how we're actually doing. And the sort of experiences that led up to the diagnosis in women who were asked is that 9 out of 10 had multiple symptoms prior to diagnosis. And of the women who were symptomatic, 8 out of 10 had consulted a health professional about these symptoms. Less than half went to consult a doctor within a month, and 6 out of 10 were very concerned or fairly concerned. And what sort of, again, quite concerning is that 4 out of 10 felt that the doctors did not initially take the concern seriously, and only 4 out of 10 were diagnosed within a month of seeing their doctor. So again, it highlights the challenge in terms of actually making ovarian cancer sort of one of the key differentials that should be discussed early. The survey also asked many different aspects in terms of things such as family history. And again, what's the importance of family history, as we're all aware, is sort of very, very significant, but also in terms of genomic testing, it extends beyond the history of family, beyond a family history. And again, I think that this survey really asked what is the sort of variation in terms of testing that's actually done in all of the different countries. And again, as you can see, there was quite a lot of variability in terms of which women are offered genomic testing or genetic testing and which women are not. Again, Australia, Canada, US, and Italy seem to do reasonably well, but there are many other countries where genetic testing is generally not offered in the women who are treated. There was also a fair amount of reflection in terms of some of the variability in terms of the sequence of treatments between surgery, chemotherapy, followed by chemotherapy. And again, the survey highlighted some of the sort of differences that occur in terms of either primary surgery, the chemotherapy that's offered, neoadjuvant chemotherapy, as well as women who are offered intraperitoneal chemotherapy and targeted therapies. And sort of urge all of you to actually look at the detailed reports of the survey. I think that this is online and there's some hard copies available. But it does highlight some of the things that are significant variabilities in the countries where we think ovarian cancer treatment should be really sort of well worked out. And I think that in terms of the differences between countries such as Canada and others, there are still variabilities that we should be concerned about, like the timing in terms of getting to the physician and getting to diagnosis, being referred for specialist treatment, variability in terms of genetic referral. Looking at this across all of the different countries, I think that what emerges is that there is a variability between different countries and in terms of how women are actually treated, in terms of whether their concerns are taken seriously enough or not. And there wasn't any one country that stood out as having all of these issues sort of really nailed down. And I think that it was a sort of really important aspect to consider in terms of the survey. And if you look at the sort of other aspects that the women reported, I think that, again, in terms of getting the information that the women need related to ovarian cancer, only 1 out of 5 felt that they had all the information that they needed. That the sort of mind-body connection in terms of actually being aware of what are the other resources and supports that are available was variable. The access to clinical trials is highly variable across different countries and between countries. And these sort of highlight some of the key summaries that in terms of the women sort of perceptions in terms of reporting, that 2 out of 3 had not heard of ovarian cancer prior to their diagnosis, that many of them visited their doctors a month just before the symptom, but still waited quite a long time before they had a diagnosis made. That, again, there are sort of a lot of missed opportunities in terms of early diagnosis, which we need to address. And there's a huge amount of variation in terms of access to specialist care by trained gynae oncologists. And there are a lot of inter-country variabilities as well. So I think that the key recommendations from this Every Woman study was that let's raise the awareness about ovarian cancer disease and the symptoms. It does require additional support and funds, and we need to sort of really get on top of unacceptable delays in terms of the diagnosis. And there does need to be significant amount of work in terms of the short-term mortality. The first 2 to 3 months are critically important, and there is a significant mortality in that, and make sure that women actually get to the specialist care that they need. I think that it's also important to raise awareness about genetic testing and the family history, and also really the key message is that access to specialist care needs to be something that is every woman who has a potential ovarian cancer's right. So these are the sort of steps in terms of awareness. So there are a number of sort of websites. I think you can access the World Ovarian Cancer Coalition organization, as well as emails to a couple of key people, and they can send the full hard copy of the report. And I think that it would be good to sort of really engage in further discussions with societies such as GOG in terms of how do we sort of raise that awareness in terms of making sure that the diagnosis is made early and women get access to specialist treatment early. So I'm going to stop there. I hope that everybody will take this message on board. And I think the key concern and the reason to highlight it here is not so much management that happens after women actually get to specialist care, but actually making sure that they get to specialist care early, and that this is not a patchy affair across the country. So thank you very much.